Good evening and Happy New Year. I am Christiana, your anchor. This is our first and another episode in year 2024, and I must say, we have come a long way and still going strong. I hope we had a great holiday and fun time with our family and friends. The topic we have for you today is one of the most crucial cornerstones of the nation. Might I also add that it's been a major issue in Africa over the years. If you are a health worker or are interested in the healthcare system in your country, this is the right place to be and the right video to watch. Whatever questions or doubts you have in mind, I believe our guests today are prepared to clear them and provide detailed explanations and facts-based solutions to the issues relating to healthcare in Africa. Without further ado, let's introduce our guests. We are pleased to introduce vibrant scholars from the Far Eastern Federal University in Vladivostok, Russia. These are people that have experienced the healthcare system firsthand. What better speakers are qualified to enlighten us on this? Today, they will be sharing their insights and knowledge about healthcare system, the issues and challenges facing healthcare, the impact and strategies and policies required to improve the efficiency and effectiveness of healthcare system in Africa. But pause. Before you start this video, or to our viewers watching online, you should probably get a jotter and a pen or your tablet because you would absolutely need it. Once our guests start addressing these issues one after the other, you would not want to forget or miss any of the details, no matter how little it is. As we dive into the topic, open your mind to the possibility of being enlightened and see what happens after the discussion. I am sure the outcome will be amazing. Firstly, I will introduce our speaker from Ghana, a postgraduate student of hygiene and a part-time lecturer. Welcome, Sine Iben.
Thank you so much.
Our second speaker is from Nigeria, a master's student of public health, Dr. Sadiq Mubarak, MBBS. Welcome.
Thank you for having me.
Our third speaker is from Nigeria, a master's student of biotechnology. Welcome, Peter.
Thank you, everyone. Thank you.
I will quickly give a background of the topic we have today. By introducing the primary healthcare strategy, the Alma-Ata Declaration in 1978 proved to be a turning point in the history of healthcare policy. Primary healthcare was defined as essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation at a cost that the community and the country can afford to maintain at every stage of development in the spirit of self-reliance and self-determination. Primary healthcare was expected to form an integral part of both the country's health system, of which it is the central function and main focus, and the overall social and economic development of the community. It would be the first level of contact of individuals, the family and community with the national health system, bringing healthcare as close as possible to where people work and live, and constitute the first element of a continuing healthcare process. Since the Alma-Ata Declaration, member states' commitment in the PHC process has been evidenced in the development of health policy, documents, and development plans. These prioritized primary health care as the main strategy for achieving health for all. Despite this commitment, and 25 years on, not much has been achieved. Primary health care in the 21st century is, and will continue to be, challenged by complex scenarios in the region, such as rapid urbanization, the emergence and reemergence of both communicable and non-communicable diseases. Now, a review was conducted to guide World Health Organization on the way forward in supporting member states on primary healthcare implementation in the 21st century. The main issues addressed by the review were, this is where the first question comes in, primary healthcare policy implementation. How have the primary healthcare policies been implemented? Senior Iben, if you can help us with that question.
All right. Thank you so much, Ms. Christina. Yeah. As you rightly said, primary healthcare has been one of the main focus of the World Health Organization and its member states since its adoption in the 1980s. However, if we follow year by year assessments of primary healthcare, you will realize that African countries have always been lagging behind. And so, how do we assess the effectiveness of primary healthcare across the countries? And I think it's enshrined in the definition. First is the provision of essential healthcare. So what are essential healthcare? To make sure that there is primary care is accessible to the people, so that there should be a system of people having easily access to first point of contact when they go to the hospital, and then also universal accessibility. You know, the health system should be accessible to everybody. And by accessibility, we want to make sure that we don't put any financial or physical barrier to accessing healthcare, as we see in most African countries, where even ambulance services are not properly structured. And then if you look at the road networks, for instance, so you realize that sometimes people get sick in rural areas, and by the time they are conveyed to the medical center in the nearest town, maybe the worst would have happened. And then also active participation. In our part of the world, I think that we don't really involve the community in deciding their health choices. We sit in our rooms, and the specialists, they just prepare their own interventions and go and give to the people. And sometimes the kind of interventions that we do as specialists, they don't really align with the belief systems of the people. So when you take it to them, they are not going to accept it. Take for instance, we have several social determinants of health, and also cultural determinants and religious determinants. My religion may forbid me from taking up a certain kind of intervention. So if you don't ask a community that is predominantly, dominated by a certain religious group, and you make that intervention, then is going to fail. Then the last thing about the primary healthcare is about affordability, which is everything. And so in 2005, at the 58th World Health Assembly, the issue of affordability of the health service was very topical, and that was when member states were being admonished to implement, alternative source of funding for the health system, so that when somebody is sick, the person does not have to pay directly from his pocket. So the concept of health insurance or medical insurance was being preached at that assembly. So I think that is how we have poorly implemented the primary healthcare system across Africa. By not making sure we provide essential healthcare, by not making sure that it's really accessible, and participation and this affordability. Because even now, not all African countries have been able to implement the medical insurance, and the few that have implemented have some challenges. Thank you so much.
Thank you. Greg, what do you think? Following the implementation of primary health care, what are the resources put in place or set up or made available for the implementation of primary health care?
Yeah, when we speak about primary health care, it's a very important sector that determines the development or the progress that a society has made from when it has been established and so on. And we have to look at this issue reflecting back on the actual principles of primary health care, which, as been explained, includes accessibility, of course, which is the first principle. And what about public participation as well? And then we bring together the health promotion, the healthcare promotion itself, and then how do these three pointers correlate, or how do they interject? You understand? So the issue of so from the implementation, as you asked, it has to do with the accessibility, because if people are not having access to this primary health care, then it has absolutely defeats the purpose of this establishment in the first place. You know, having the institutions that provide these primary health care services is one thing, and having access to these institutions is another thing that is totally different on its own. Um, we have there was a very important research that was conducted in some parts of Nigeria about the prevalence of tuberculosis, for example, and it was found that the level or the incidence rate among the nomads was higher, like way higher when you compare it with every other division of the community. Why is that? This is because those people in these so-called nomadic settlements have absolutely no access to the primary health care system. And if that is the case, that means we still have a very huge task ahead of us on how we can, implement methods of delivering this health care to not just him, her, but to everybody. Yes.
Thank you. Peter, what do you think? How do you think the government or WHO or the responsible agent or the following bodies can make healthcare accessible for the community, for individuals and people? What are the things that need to be set up to put in place so that people, normal people who are not on the higher class, can have access to this basic primary healthcare?
With due regards to all the scholars on seat, Dr. Mubarak and Dr. Iben, they have already covered most of the points, but if you was to address your question, I think we should look inward than looking outward. Because the WHO, to me, they are doing excellently well in attending to the health situations in Africa. Because as I know, WHO, IMF, they give preference to African countries when allocating funds. And they keep doing this consistently. So now, why are some problems and some issues regarding primary healthcare in Africa still thriving? That means that now it lies within us, it lies among us, and we should point out some issues in this that is not making the WHO effort to hit the mark yet. One of the reasons is, I don't want to put everything on our government, but let me say it still starts from now. Of course, we still come down to also point out why you and I are also part of this situation. There was a meeting organized by the WHO that was in the beginning of this century, where they called all national heads and head of states together, and they agreed on some goals for this new century. And part of it was this primary healthcare situation. They want to draw the child mortality to zero, the maternal mortality to zero, and some other disease outbreak to keep African countries, informed, in shape for any outbreak. And they told these African leaders that, see, we check your records. Every year you provide about 4% of your budget to healthcare system. Please, to achieve this, increase this to about 15%. This would help to set the ball rolling, at least to keep our goals at sight. All agreed and said yes. But you see, after that meeting, 7 of these countries reduced their budgets. From that 5%, it dropped. And I checked through. Nigeria's budget for this year, Nigeria, just as an example, remained at 5% for healthcare. So, and the population keeps increasing, and our budget to finance this system is not changing. So how do we expect the external bodies' effort to show? Should we keep pushing everything on them? The country doing well as per health systems in Africa, about the primary healthcare system in Africa, I think we should give it to Rwanda. Rwanda, to me, are even doing better in some aspects than America, regarding to the health, to providing adequate health healthcare for their citizens. But you see, more than half of the funds they use for their health system is yet from external bodies.
Okay, according to you, you're saying the government should increase the budget allocated for healthcare. But
More attention.
is there anything organizing bodies or institutions, healthcare institutions can do to give better access to communities, to individuals, like maybe vaccines, healthcare awareness, something that would make people's interest in pursuing a better healthcare, just an access, something that would bring their interest to engaging in such. Is there any other thing aside funding that you can think of?
Yeah, as you have highlighted the point about the vaccines, about maybe also providing some public lectures, enlightenment, and about all this, I will tell you that these bodies are doing this excellently well. If I'm right, doctors are here. More than 90% of vaccines circulating in Africa is coming from these external bodies. And they ensure that they even provide funds for the health workers to administer these vaccines, taking it house to house from their home funds. And they also organize training for doctors in Africa to upgrade them about how to address some disease outbreak and this and this and that and that. Well, I think in those aspects they are doing well. But what I would still want them to do more is that they should go to the suburban regions and they should establish facilities, healthcare facilities. They should create more health centers and equip the system to strengthen the health system.
Okay, very much.
If I may add one or two about the allocation to the health sector. Yes, it's very important, but I always want to go back to the big financial challenge in Africa. So much as the WHO would want us to spend that amount of money on our health sector, for example, maybe other institutions are also asking for this for some attention. So the thing is that when you look at public health, what works best for us is intersectoral collaboration, right? So the health status of a people is not only determined by the hospitals and facilities that we build. That will be focusing much more on the creative aspect, right? But if you want to have a holistic approach to the health status of people, we should look at the other sectors. Because if the roads are improved, if buildings are disability friendly, if the environment is clean, then a lot of people are not going to fall sick. So it's not just about allocating money to the solely specifically for the health sector, but also making sure that we're able to harmonize all the other sectors, so whatever thing they do are geared towards making people healthy. So when you're building roads, what specifications must you do so that the roads don't cause accidents? Because you go to some roads in Africa, they don't have proper markings, speed limits and all those things. You look at environmental pollution, climate change, farming even. Farming is very important because from the time that the seeds are planted up to the time that it gets to the consumer for him to eat, we must to ensure the integrity of the food, that it doesn't get contaminated. So all these things are big challenges that we have to look at it in broader concepts, rather than focusing it on the what do you call it, on funding health system, so to speak.
Yeah, I would also like to chip in to what my dear colleagues here have added.
Derek, I have an interesting question for you, so I would like you to skip that part.
Oh, sure.
We have so many questions, and I don't want us to waste time on that. So after the implementation of primary health care, we know that there were policies and strategies put in place to monitor and review the progress of primary health care in Africa. In your opinion, how do you think the primary healthcare policy and strategies are being monitored and reviewed in Africa?
Yes, thank you. This is a very interesting question because it has something to do with my point that I wanted to add to what my colleagues here have spoken about. So we have to take a little step back the very difference between these two terminologies. These terminologies are healthcare law and medical law. You know, these are two different things if we look at them in a very microscopic view. But when you look at it from like an overview from afar, you might actually interuse them, or you might mistake one for the other. So if we are we know the difference between these two phenomena, then I think we have to, of course, focus on this. As Mr. Peter here has spoken about prioritization of the healthcare system by upping our budgets for the African countries. Mr. Evans spoke about what was that?
Famine.
Yes, about other industries that are also interrelated to the healthcare system, well, which are like, let's talk about the dependable variants that affect our healthcare system. How about if we focus on establishing laws that are going to have a very close observation of how the system moves. We have something called public health surveillance. So in this public health surveillance, we have a series of activities that we carry out that cross-check the system. If, for example, we have a disease outbreak, so how do we estimate the magnitude of this problem? This is one thing. Okay. Another thing, we have to estimate the geographical distribution of this problem. How do we do that? We have to, of course, standardize laws and provide our workers with equipment. If it's logistics, good. If they are like training kits or even training itself for some specific problems, these are good things. We have a lot of points that we use in public health surveillance. Why don't we work with this in Africa or in our countries, for example? We have series of things that are not only about funding, or that are not only about non-governmental organizations, but our own individual negligence. These things are there. We have a system that has been there for a while. We have employees that are in the system, but these people don't answer to their responsibilities. Do you understand?
Thank you very much. Now, moving to the challenges, the major challenges in healthcare system. In 2016, across lower middle income countries, an estimated 8.6 million excess deaths were attributable to healthcare, of which 5 million were due to poor quality of care and remaining due to non-utilization of healthcare. In the World Health Organization Africa region, countries face challenges with poor quality of care, which have been associated with the worsening outcomes of health. Despite strong efforts and commitment to increase the scope of interventions available in the service delivery system and access to them. Now, what are the issues regarding poor staff attitudes towards clients and bureaucracy in facilities, healthcare facilities? Peter, please, can you enlighten us on that?
Well,
Let me try to reframe the question.
okay.
Issues regarding poor staff attitudes.
Okay.
I personally can say in Nigeria there are some hospitals, healthcare facilities where the attitudes of healthcare workers are not professional towards So what can
Exactly
you say?
what I was talking about.
Yeah, so what can you say about that and how it has affected healthcare system in Africa generally?
I think in every organization, if you want to get maximum output from your staff, you need to also give them your maximum also.
Thank you.
When they know that you are giving them the best you can afford, then they will give you the best they can give. I think these two equations or these two sides is not balanced in the Nigerian healthcare system. The workers feel cheated by the government, comparing themselves with what their colleagues in even countries that are not doing well as the country that they are working. They compare and see what their colleagues in other countries are getting and how
In Ghana, for
comfortable they
example.
live. Of course, Ghana is doing well. So
Yeah, exactly.
You want to talk Nigeria, Ghana, yeah, we can't do that.
No, I'm just giving an
Ghana is doing
instance.
well.
We have to appreciate our neighbors that are doing good.
Thank you very much.
Yes. And you now compare with the working condition that you have. For example, in my university, my university has more than 50,000 students at that time. And this clinic also attends to the health needs of the staff of the school, which also surpassed maybe 5,000 at that moment. There was a time that I had some health conditions and I had to visit the hospital regularly. I noticed that there was only 3 doctors. If I don't meet one, I meet the next one, I meet the other. And it is 2 offices. So only 2 doctor offices for the whole school? How? Why? So by this, the doctors are overworked, the nurses are overworked. The nurses have to act as doctors sometimes because of students are on queue and people are from, so something has to be done. Now, there was a time that the doctor was to attend to me and a nurse came in and said, "Doctor, you have not eaten." He said, "Oh, later. You see, he himself is stressed out. You can't expect him to like continue doing the job with happiness in such working condition." So I think there should be balance with the with good working condition before we expect maximum output from the health workers.
Thank you very
Yes,
much.
I would like to add a single point, please, if I may.
Just me.
Yes, I don't like it when fingers are pointed at only the workers, all the blame being on the workers. How about the system being fair to them? How about the system being fair to them? When an individual, or let's say a practitioner, is working under duress or being frustrated with the working conditions and the environment, this is when we start having what we call patient bias or treatment bias. Mr. A comes with his child, and Mr. B also comes with his child to the doctor. Mr. A is willing to, help, do something to the doctor. I don't know how to put it, but try to support him in any means possible. Mr. B is just there because he thinks he's entitled to the service of this doctor. Of course, as a doctor who believes that he's underpaid or his working conditions are not favorable, he's going to attend to Mr. A's child as soon as possible.
Another line fact, please, in 1 minute, that also needs to attend in this is that sometimes, or in Africa, we see a rush into the medical profession because it is widely acclaimed to be a golden profession, to be a profession where you can enter and escape poverty. So actually, many people that have no passion for what this job requires are into it. Now they got the certificate, they got the job, but they are not happy.
There's no satisfaction.
No satisfaction.
Absolutely.
They
Especially,
just shout at you anyhow. In fact, they see patients as the disease itself.
Thank you.
yeah, especially for the nurses, Ghana, and some years back when we had few nurses, the government came up with a stipend system. We call it allowance system for people who wanted to study in the nursing training colleges. So it's cool to encourage them. Now we have too many people rushing into that field, like you said, not because that is what they want,
Not because they have the passion to
but it's
change.
because that is, if you look at all the systems in Ghana or in Africa, it's only the health system and the education system that normally offer ready job, mostly 2-3 years after you've graduated. So a lot of these people go there with no passion for the job, and so when patients come to them, they feel like we've come to disturb me and all those things. But it's much as we are talking about why the health workers are behaving this way, we also have to look at the impact on the citizens. And because, for example, for women who go to the pregnant women who go to the hospital to have their babies, if they go there and they are being maltreated in their subsequent pregnancy, especially in the rural areas, they will decide to stay home and go to a traditional birth attendance. So it's a very important question that we would have to address. And this goes with occupational health and safety issues. I don't know if that is, we can talk about that later, or maybe I can add, but maybe later when you throw a question, I can talk of, or they call it occupational health and safety issues for the health workers.
Thank you. Mubarak, what do you think are the problems of hierarchical dynamics which influence compliance to care protocols and levels of accountability system of users, like poor operationalization of facility-based therapeutic communities and regulatory agencies to monitor the quality and safety of care? Basically, in a hospital setting, there are hierarchies. So, what are the agencies or committees put in place to check accountability of staff?
Yes, that's a very interesting question. That is why it is recommended that every healthcare institution should appoint a leader or like the topmost authority to be not only a clinical medical professional but also a public health expert. This is very important because if we have like an inside regulation, then the outside forces will not have any need to verge into your business. But yeah, of course, we have institutions that are there to checkmate the running process of every healthcare institution. And this can be departments that will be established by the health ministry of every country. We have those. We have non-governmental agencies that are like that. Their sole responsibility is to assess or to access the healthcare quality of a community. And this is by, of course, checking how the healthcare institutions deliver these services to the people. Because if we have, let's say, a government hospital that are being negligent with their patient care, then of course we don't expect for the the quality of life of the people living in that environment to be improved. You understand? We need to have those checkpoints or those periods whereby we come in as public health experts or like a group or a team of those specialists to check how do we assess if there is an outbreak. If a patient comes to a doctor with a disease that have, let's say, an infectious disease character, we don't only treat that patient and let go of him. No, we have to go down to the root of this problem, and this includes, an overall screening of the society, or at least start with the family. We have what we call household contact. We have to start with this. If not, before you know it, we have an outbreak, we have an epidemic, we have a pandemic.
Thank you very much. A brief result of the study. According to an article published by Teslimke Babalola and Interest Moodley in 2020, a research was carried out to review healthcare facilities efficiency in sub-Saharan Africa with respect to the methodologies used as well as outcomes and factors influencing efficiency. The outcomes showed that less than 40% of the studied facilities were efficient. There was a marked degree of inefficiency across the healthcare facilities. Consequently, due to severe resource constraints facing sub-Saharan Africa, there is a need to determine how to use the available resources optimally to improve healthcare system performance. Peter, I will throw this question to you. How do we improve the efficiency, like utilize the available resources to produce the best outcome of healthcare in Africa?
The question was on two sides. Is it the human resources or just the infrastructural facilities?
I think this is looking at it holistically. Human resources and infrastructures, everything that is going to improve efficiency in the healthcare system.
Okay. I believe it all boils down to what we have raised earlier on management and adequate monitoring and supervision. Of course, the most important resources in any organization is still human resources, because no other resources can operate without adequately trained quality human resources manning these facilities. So the healthcare workers and medical personnel should be enlightened, and they should know that their work goes beyond the pay or the poor working conditions. They are saving lives, and they are doing, and it is more like service to humanity, which I believe has reward beyond this earth. So they should do it with all enthusiasm and expect that maybe that of course one day situation will change and their service will be more appreciated. Yeah, so let's wrap it there.
Sneven, how do you think we can assess the health facility efficiency?
Yeah, having efficient use of the health facilities across Africa has really been, very topical, and it has been a focus of research for quite a lot of researchers. Right? So first, if you talk about efficiency, that is, achieving a goal with the resources that are available. Right. So what are the goals of the healthcare system? One of the cardinal goals is about improving the health status of the people. So if we have a health facility and everything that is in there, talking about the human resources, talking about the finances, talking about vaccines, medicine, vaccines, drugs, and technologies, talking about the information system. All these are things that are being utilized to ensure that the people have a longer life. So for us to have efficient use of these resources, then we have to tackle each of the 6 building blocks of the healthcare systems. So service delivery, how are we making sure that we deliver services to the people, for them to have access to those services. This question may draw me back to an earlier point that I wanted to raise about the rural healthcare system, how to get, how to make these health resources available to them. These days, telemedicine and telehealth is very important, right? So somebody stays in the remote area and will still be able to have access to a medical doctor. It could be true. You can also have through SMSs, and then to provide what called updates and all those things. So yeah, we have to also make sure that the finances that are being given to the health institutions are being utilized judiciously, right? The fact is we have challenges with finances already in Africa, as we always talk about. So with the little that we have to make sure that we use it well. And if I don't know, but I think most of the outreach programs that we organize, we have to check them very, very well, because sometimes budgets are raised and then so on and so forth, and lots of money are missing somewhere along the way. So we have to check all those things then.
Dr. Mubarak, from what's needed as said, like telemedicine, for example, how do you think this would help us? Like, if we are to put in place systems that are going to assess efficiency of healthcare, how do you think they're going to help us, and in what areas do you think they would address?
Okay, so let me understand the question clearly. Are we talking about how telemedicine will affect or will improve healthcare service delivery, or how telemedicine can be used to check the efficiency of healthcare service delivery?
How they would help us to improve healthcare or to access efficiency in healthcare. Let me just rephrase it. I asked
These are two things.
We said, I asked Sneven, how can we assess health efficiency, right? And in this state telemedicine, for example.
Oh yeah.
Yeah. So now I'm asking that how would this help us to assess the efficiency in health facility?
Well,
and what areas particularly?
Yeah, I understand. Well, telemedicine is also a broad branch of medicine that came with time, with especially our 21st century invention. Yeah, and we have several methods. As he mentioned, he gave example the use of this very telemedicine. Yeah, and in my opinion, of course, we can also employ the service of this telemedicine in a method, in a way to assess the efficiency by going back to probably when there was a problem, like let's say a disease outbreak in a certain community. Let's take this, for example, as a simple way to have this study successful. So we have some data that we can use, which are also computer based, and of course related to telemedicine. We have some two concepts that are being used for assessing such problems. We have the descriptive and analytic concepts. In the descriptive method, we aim to assess the who, what, when, and where of a health event. Okay. While in the analytical concept, we try to understand the why of a health event. So in this case, if there was a disease outbreak, let's say in 2020, if we try to employ the service of, let's say, information technology or telemedicine as a little term, we are going to use our available resources to go back and collect data from all the healthcare institutions in that community to be able to understand, okay, who was the patient that first reported the that came with the symptoms of this very disease that occurred at that time. When we understand, then we have to look at when, because we go by the timeline, yeah. Then we're going to look at how and where it started, and these are things that are going to help us in prophylaxis, in prevention against the future, and also at the same time it will help us to assess the effectiveness of our response in the institution.
Thank you very much. According to a research carried out in 2019, right, it listed some challenges faced in healthcare in Africa, healthcare system in Africa, like inadequate human resources, inadequate budgetary allocation to health, and poor leadership and management. For example, they give dilapidated healthcare systems and facilitated medical tourism, for example, leading to over 5,000 people leaving Nigeria every month for various forms of treatments abroad, and about 1.2 billion US dollars lost from the Nigerian economy to medical tourism here. Also, human resources shortages and brain drainage from Africa to Europe, the Middle East, and North America compound healthcare outcomes. Healthcare sector industrial action, like strikes, is frequent in Nigeria, where it has complicated most aspects of the healthcare service delivery and consequently prevented the optimal healthcare delivery to the Nigerian population. Now, Sinaiben, what are the strategies necessary to reduce these challenges? And these challenges are already listed: inadequate human resources, budgetary allocation to health, brain drainage, poor leadership and management. What do you think?
Yeah, this is very, very pathetic, because we sit in Ghana, and we go to Kotoka International Airport and we see a lot of youth day in and day out leaving the country, and Kotoka International Airport has now become the door of no return, where when the youth, once you're able to get your visa and you say bye-bye, that's to Ghana, and the system is, and like we said already, we don't have a lot of personnel. Already we are understaffed, and a lot of people are leaving. In Ghana, for instance, by the first quarter of last year, about some 4,000 nurses had left. There was one medical superintendent of a hospital who came to really, lament the number of medical, workers that had left the facility. So it's a really, really tough thing. But hey, each one for himself, God for us all. If I live in a country where my services are not welcomed, as in, they don't pay me well, talk about, I'm very passionate about this, talk about occupational health and safety. One day I spoke with my sister, whether before they are being employed, they had to do medical examination. She said no. In developed countries,
That is catastrophic.
in Russia, Even to be a people teacher, you have to do medical checkup, and you do it periodically, so we know that you are having this. So it's the reason why people are living. It's not just about the finances. I always say that our leaders should look at giving decent lives to people. Let people feel as if they are humans. You don't put a person in a lab, deny him of equipment, and expect him to deliver. So he gets up, goes to the lab, and the person has studied. He wants to, advance on whatever thing he has studied. So all these things are very, very important, and they will always go back to finances. They'll always go back to finances because it's only a poor man who has a lot of problems. When you are rich, you don't seem to have a lot of issues. So what financial models can we use so that we pay our workers well, we give them the best treatment? In elsewhere in advanced countries, they have occupational health and safety hospitals, clinics, where if you fall sick, maybe as a medical doctor or as a nurse, you go there, and once it is established that you fell sick because of your work, or you got a disease in your working environment, you are given some compensations and you're treated free. Does that happen in Africa? No. Talk about leadership. Leadership has always been the important factor in everything across Africa. You talk about the education sector, you talk about leadership and everything. And leadership and governance is an important aspect of the building blocks of the healthcare system. If we don't have quality leadership, we are doomed to, we cannot move anywhere. And like Dr. Mubarak rightly said, for somebody to manage a hospital in Ghana, I think that the highest person that manages a medical facility will be the medical superintendent. And you are managing a whole health facility. Public health is broader than any other aspect. So you should have training in public health, so that you will learn health promotion, you will have knowledge in epidemiology and a whole broad of things, so that you'll be able to effectively manage these institutions. Another challenge perhaps that is very critical is about technology. Now technology is everything. Information. Let me even go back to information. You see, sometimes it's very sad. You're doing research, you want data from Ghana, you can't find it. You have to go to the World Health Organization website. So how are we keeping our records? How are we getting information? And how do we make sure that we disseminate the information we have to the people? Because at the end of the day, whatever thing the health sector is doing is geared towards the population, the citizens. So should we embrace telemedicine? Yes. Electronic health records? Yes. So if once we're able to do this, then we'll be advancing, towards removing some of these challenges that we are constantly faced with.
Thank you. Peter, what do you think are the proper measures that can help reduce financial risk? Basically, this is about insurance policy. We know in developed countries, they have insurance for their citizens, be it private or government-based. And this has helped citizens to be able to have access to healthcare in emergency situations or planned hospital visits. But in Africa, it's not paramount, the issue of insurance policy. So how do you think the government can help, or private institutions can help to reduce financial risk for people who don't have access to healthcare, for poor people or average people?
Yeah, thank you. It's one of the things I wanted to raise. It's good that we can discuss this point now, because in Africa generally it is a concern. It is a concern. You see people locked up in their rooms, money in pain because they can't afford the medical bills, and they are citizens, full citizens of this country, whose sweat and financial contribution has built the nation. Yet they can't get access to basic medical care. Now, this should be addressed. Because in most countries in Africa today, even no matter how citizen you are, you like citizens still pay as much as 90% of the actual medical fees. In developed countries, it is so subsidized that you hardly feel the brunt. In fact, in countries like Russia or United States, once you are subscribed to a comprehensive medical insurance, which is so affordable, your medical care is covered.
Well guys, we just concluded this episode of Bantaba. If you're watching this video, it means you already know how it went. I can bet you had a great time. We will be here next week, same time, same venue. Stay tuned. It's your favorite host, Christina. Bye.